It is a great satisfaction to greet you again. I hope you and your pet are well. Today we will talk about the following. My dog has snot. Why and what to do? If your dog is sneezing constantly and has a runny nose, it can be frustrating trying to determine the cause. There are many potential causes of a runny nose in dogs, some of which are relatively benign and easy to treat, while others may be indicative of a more serious problem. In this video, we'll talk about the most common causes of a runny nose in dogs, as well as how to treat them. 1. What is a runny nose in dogs and the most common causes? A runny nose in dogs is a condition in which the dog's nose secretes an excessive amount of discharge. With a runny nose in dogs, there are a few types of discharge that you may notice. The most common is a clear, water-like discharge, a cloudy mucoid discharge, or a thick greenish discharge. Also, the discharge can be unilateral, on one side only, or bilateral, which means both sides, both nostrils. Common causes are: allergies will commonly cause a bilateral clear to cloudy nasal discharge. Other symptoms like sneezing or itchy skin can be noticed with allergies. Tooth disease, typically seen as a unilateral or bilateral mucoid nasal discharge. Bad breath, halitosis, is also often seen with dental disease. Strange object, commonly seen as unilateral, one-sided, that is greenish or mucoid in consistency. A foreign object can be something as simple as grass or a stick. Fungal infection. It is usually seen as a clear to cloudy, mucoid, unilateral, or bilateral nasal discharge. Other symptoms like sneezing, fever, and lethargy can also be noticed with a yeast infection. Neoplasm or cancer. It usually causes a unilateral, one-sided, thick green mucoid discharge. Other symptoms such as weight loss, lethargy, and anorexia may also be noted with cancer. 2. How can you tell if your dog's runny nose is serious or not? In general, a runny nose in dogs, if it is clear, is not a serious condition and can be easily managed at home. However, there are some cases where you should be concerned and seek veterinary attention. You should contact your vet if you notice any of the following symptoms: unilateral, one-sided, nasal discharge, green or blood-tinged nasal discharge, affecting one or both nostrils. Symptoms that accompany a runny nose in dogs, such as coughing, lethargy, or anorexia, loss of appetite, loss of airflow through the nasal passages that can be identified with excessive panting or shortness of breath. 3. How is the cause of runny nose in dogs diagnosed? Your vet will start with a detailed physical exam. You should be able to assess the type of discharge, which nasal passages are affected, and if any other symptoms are present. Additionally, a complete oral exam will be performed to look for any dental disease that may be causing the runny nose. In some cases, your vet may recommend additional tests such as X-rays to look for foreign bodies or masses in the nasal cavity. CT or MRI scan to further evaluate the nasal cavity for masses, foreign bodies, or other abnormalities. Nasal swabs, to collect a sample of the discharge for analysis to assess the types of cells that may be present. Rhinoscopy, a procedure in which a small camera is used to view the inside of the nasal cavity. 4. What is the prognosis for a runny nose in dogs? A runny nose can be caused by a variety of things, including dental disease, allergies, fungal infections, foreign material, cancer, and idiopathic causes. If your dog has a runny nose, it's important to take him to your vet so he can diagnose and treat the cause. Some symptoms to look out for include one-sided discharge, greenish or blood-tinged discharge, facial asymmetry, shortness of breath, and loss of airflow. Mild cases with a clear discharge often do not require treatment, while more severe cases may require medication or other surgical treatments. The prognosis for the condition depends on the cause and how well it can be treated. If a foreign body is removed from a dog, the prognosis is good. However, if the dog has cancerous growths on the nose, the prognosis is poor. For dogs that have an upper respiratory infection, if they experience damage to the turbinates, a type of nasal bone, or to the epithelium, outermost layer of cells, this often becomes a chronic condition that can be manageable but never cured. It is a pleasure to inform you and help you. If you have not subscribed to the channel, you should do it now. Take care of yourself and your furry friend, a hunt, and until the next video,